Hello everyone, I'm Dr. Umi from Sunway Medical Center. Today I'll be talking about laser vision correction. So let's know about laser vision correction a little bit more. Patients come to me complaining that their glasses is too thick, too heavy, and it prevents them from doing their daily activities, from doing what they like. For example, hiking, swimming, some water sports, etc. Those who opt for contact lenses also noted that they are not able to tolerate contact lenses over more than a few hours a day, although previously they've been wearing contact lenses for a long time. This happens because of contact lens intolerance. So they ask for some alternative, and laser vision correction might be the answer for them. So what is laser vision correction? It is essentially a minimally invasive surgery done on the front surface of the cornea. This is called minimally invasive because we do not enter the eye at all. The surgery is done only on the surface, which is a transparent structure or tissue, which is a window to the eye that allows light to pass through. Laser vision correction is quite an established procedure. It has been around for over 30 years with photorefractive keratectomy, although this procedure has been largely superseded by LASIK. So LASIK, which is more familiar to the public nowadays, is actually an acronym for laser-assisted in situ keratomyelitis. So instead of doing any ablation on the cornea, LASIK involves a creation of a flap or a small piece of tissue which is separated from the corneal surface. This allows ablation procedure from the laser to shape the corneal surface, and once that's done, the flap will be replaced back onto the corneal surface. This ensures that patients has a faster visual recovery, an excellent visual outcome the next day, with a good and better experience and more comfortable experience after the surgery. So moving on from LASIK, which was 20 years ago, laser has been introduced in the market about 15 years back. The flap creation is using FemtoLASIK, where the cut is more precise and it gives a better visual outcome for the patient as well as less flap-related complications. So although we are able to reduce and minimize the flap-related complications such as buttonhole, flap loss, or even torn flap, we are still seeking for a better way to improve patients' comfort and at the same time do not compromise the visual outcome of the patient. With that in mind, SMILE was introduced about 8 years back. SMILE is actually an acronym for small incision lenticule extraction. So it eliminates totally the flap-related complications by utilizing a very small incision over the top part of the cornea. So instead of using a flap, small incision lenticule extraction utilizes lenticule extraction through a very small wound. The wound is about 80% less than that of LASIK. So with that, patients have an even excellent visual outcome. They usually get about 80% of vision on the same day of surgery and gain about 98% of their visual potential the next day. This gives patients a high satisfaction rate as well as much more comfortable vision, much more comfortable experience, and the eye will look almost like they did not go for surgery at all the next day. So it eliminates, apart from eliminating totally the flap-related complications, SMILE also gives less issues with dry eyes, which is a common thing that patients found after LASIK surgery. It's almost like a keyhole surgery of the eye, and this gives patients another alternative for their vision, to improve their vision with refractive error. Thank you.